Hi, everybody. My name is Dr. Amy Doneen, and I come to you from Spokane, Washington. Thank everybody for joining this evening, and we're going to spend the next 60 minutes talking about women and our hearts, a message of reality and hope. And what I posted online was the real deal. So I am the director and owner of the Heart Attack and Stroke Prevention Center in Spokane, Washington. I'm an adjunct professor at Texas Tech University in Lubbock, Texas, and I am the co-founder of the BaleDoneen Method with my partner, Dr. Bradley Bale. So welcome, everybody. With all that being said, this is by far and above my most important accomplishment, and I am a working mother, and I care deeply about being a mother, being a sister, being a daughter, being an aunt. And as I go through this presentation today, I come at you as a colleague, a partner, and we really, as women, we must be our best advocates and recognize that not only do we need to remain healthy for ourselves, but certainly for our family as well. And I see so many women all year long that put their health second. And if I do nothing else tonight, but to encourage all of you to place your health as the top priority. You know, when you fly on an airplane and they say put the gas mask on yourself, or the gas mask for land's sakes, put the oxygen mask on yourself and then put it on the person next to you or your child. It always seems a bit odd to be told that, but really, if our health goes down, a lot of people are going to suffer, so please take that to light. So these are our three children. Our youngest is a sophomore in high school. That's Sophie on the left. Devin is a freshman in college, and Sydney is a junior in college, and she's on the right. So by far and above my most important accomplishment. I like always the power of education, both educating ourselves and educating one another. I like this quote particularly by Dr. Nelson Mandela: "Education is the most powerful weapon which you can use to change the world." So what I want to do tonight is share with you some facts. We need to be aware. We need to know which one of us might be at risk for this disease called heart disease. What actually causes a heart attack or stroke? I want to talk to you about what is it that we're actually trying to prevent here. And then I want to talk about inflammation as really the key to our risk. And then I want to give you some top 10 health tips to say you can be healthier tomorrow if all you do is one of these things. And it's not the traditional eat better and lose weight type of discussion. It's really things that we can incorporate right away. So we must open our eyes to this disease. Please understand that 1 out of 3 of these beautiful women sitting here, if we don't do something different in this country to identify heart disease early, one of these 3 will die of either a heart attack or stroke. Heart attacks occur every 25 seconds in this country, and every minute someone will die from one. 1 out of 3 of these beautiful ladies will also suffer the same fate. Every 40 seconds, someone in the United States has a stroke. Women have the highest rate of recidivistic stroke. What that means is we have the highest rate. If we have a stroke, we're at the highest risk of having another one, and that needs to stop. 64% of women who die suddenly of a heart attack had absolutely no idea that they had heart disease. The death rate among women ages 35 to 44 has been increasing by 1.3% per year since 1997. Dr. McSweeney in 2003 did a study. She asked women who were in the hospital with a heart attack, she said, "What did you feel a month ago?" And she also asked them, "What did you feel at the time of your heart attack?" I want you to pay attention to these symptoms, ladies. A month before they had their heart attack, they said, "You know what? I was tired. I wasn't sleeping well. I was kind of anxious." At the time of their heart attack, shortness of breath, abdominal pain, and sweating. What don't we see here? We don't see crushing chest pain, an elephant on our chest, left arm pain, jaw pain. We don't see the classic symptoms often advertised. So I always tell women this: if you feel differently than you ever did before, consider the plausible fact that it could be your heart. The other issue we have here is unusual fatigue, sleep disturbance, and unexplained anxiety. Those symptoms are justified in life and working a lot and coming home and raising a family or going through menopause symptoms. We dismiss all of these symptoms, and it might be our heart trying to tell us something. So please pay attention to your body. It's an honor to educate women about heart disease. We are different and we should celebrate that. Our symptoms are different. Our hearts are smaller. The assault for which our heart muscles could take is less. Our vessels are smaller. Our arteries are narrower. All of these things matter. And remember, Ginger Rogers did everything Fred Astaire did, but she did it backwards and in high heels. So ladies, we need to pay attention that we've got a lot going on in our lives. So what is atherosclerosis, which is a big word? What does plaque look like before someone has a heart attack or stroke? What does it really look like? Well, I'll share with you, it looks like this. It looks like this. Nobody says, you know what, I'm free next Saturday. I think I'm going to have a stroke next Saturday. No one says, I'm free this afternoon. I think I'm going to have a heart attack today because I have no dinner plans. No one plans for these events, and it happens to people every 30 seconds. People are dying from this every minute, and not one of those individuals planned for it. They didn't expect it. So what we need to understand is plaque is silent until it's not. What plaque looks like, it looks like this. It's sneaky. It hides in the artery wall, virtually out of sight, out of mind. You can't feel it. You can't necessarily touch it. The images that are historically looked at, like stress testing and even angiograms, don't shoot the line of sight in the right area. We don't look here. We tend to look at this opening. We don't look for this plaque. And if someone has an inflammatory situation going on, it could be influenza B, it could be a silent tooth abscess, it could be cholesterol that's not managed, it could be untreated sleep apnea. Anything that causes inflammation can cause that plaque to rupture, and when that happens, the body says, don't worry, I know you have an injury here, and the body sends in a clot, and that clot blocks the flow of blood. Now, if the flow of blood is blocked in the heart, let's say right here, we'll call it a heart attack. If the flow of blood is blocked up here somewhere, we'll call it a stroke. And if it happens time and time again in these small little capillaries in the brain, we'll call it memory loss. So it's really important to know if we have plaque hiding in the wall of the artery so we can prevent it from misbehaving. So how can we find the disease before it causes a heart attack or an ischemic stroke? How can we find it? So traditional medicine, even traditional cardiology, looks here. It looks at the lumen. It shoots a vision here. It looks for blood flow, and we're looking to see, is this artery open or is it closed? Well, I have something to tell you, and that is the plaque, which is right here, is much smarter than the technology that's been historically designed to find it. So if we rely simply on looking here, we're going to miss the fact that someone is walking around with plaque. That's why people can have a stress test and drop dead of a heart attack the next week, or have an angiogram and be told they're fine and still have a heart attack. So what we do is we look for plaque in the artery wall, and we ask ourselves, is it there? How inflamed is it? What caused it? And we go after it and we treat it. So it's very, very nice to be able to have the technology to do that. And I am by no means saying that this technology is more important than knowing if you have a blood flow issue. They're equally important. But you must remember that if this test you're having looks for blood flow, it cannot tell you if you have plaque hiding in the artery wall. I want to share with you a short video of a woman that is really near and dear to my heart, and she had a test that we commonly do. It's called a Carotid IMT test, and it told her that she had a problem well before she could find it. And so we do have the ability to find plaque before a heart attack or stroke. There's lots of tests that we can use too. One is called a coronary calcium scan, and one is called a carotid intima media thickness, and it looks at the wall of the arteries of the neck to look for plaque. And I want to introduce you to this lovely woman. Her name is Sue, and she's in our book, and she was very gracious as to share her story. But I share her story because she's one of the most fit individuals I've ever met. She is a championship swimmer, and among her many other talents. And her story demonstrates that no matter our size, we are all vulnerable to this condition. So I'm going to share a short video of Sue talking about when she discovered how important it is that she actually pays attention to her vascular health. She came to see me, actually, she was with her husband, and I said, well, why don't you get an IMT while you're here, this test? And she did, and at the time she had a shoulder injury from a biking accident, and you'll see her mention the injury, but I want to show you Sue now.
I was sitting there in pain in the doctor's office looking around at all these other people waiting there, thinking, I really don't belong here. I mean, I am fit. I know I have an injury here, and but I'm fit. And I looked at everybody else, and just by looking at them, I could tell they're not fit. I am. I don't belong here. So I went in to have my evaluation, and I told that to Amy. I said, Amy, I was apologizing. I really, I apologize. I hope I didn't waste your time. I know I don't need to be here. And she said, oh, yes, you do. You need to be here. It really got my attention. My IMT showed that my arterial age was 77 or 78. That got my attention. I thought, oh, okay.
So here is a picture of Sue winning the Senior World Cup freestyle swim with vascular disease. So no matter our size, no matter our fitness level, this disease takes no, leaves no one. Not everyone has plaque, but if you do, you need to find out and you need to treat it. So the other point I want to make with plaque, before I give tidbits of how to prevent it and who should be at risk, I want you to appreciate the fact that it's really inflammation that drives vascular disease. This was proposed by Dr. Virchow many, many years ago, up to now 160 years ago roughly, where he proposed that inflammation is really the driver of atherosclerosis. So any inflammatory condition can drive our risk for heart disease, and that's an important concept. So one of the best things we need to do to keep our heart safe is keep our arteries cool. And reduce our inflammation. So why is the current risk factor scoring system often misleading? Why are we missed? I mean, why are we missed? We're missed because the scoring system, and I know this is kind of small, but I'll just verbally state it, they ask our age, they ask our gender, they ask our total cholesterol, if we smoke, do we have a low HDL? What is our systolic blood pressure? And it's thrown in a calculation. And if your calculation is less than 7.5, meaning you have a less than 7.5% chance in the next 10 years of having a heart attack, you're told to go home and you're fine. The problem is a lot of people who are told they're fine on the common risk factor scores are not. This has been challenged over a decade. 222 adults who had a heart attack at a very young age, men under 55 and women under 65. Dr. Okasa did the National Cholesterol Program guidelines that I just showed you, missed 82% of these women and 66% of the men. So we must do a better job. So that's why we started the BaleDoneen Method about 16, 17 years ago. We said, okay, if this approach where we rely on risk factors only is vulnerable, meaning we'll pick up some people but we'll miss many people, let's stand on a foundation of inflammation. Let's look for disease, let's look for inflammation, and let's go after it. So that's where we started this whole approach. So I want to share with you a few little things that women I want to pay particularly attention to, what we call red flags. So how do we know if we might have increased risk for the development of heart disease in our lifetime? Red flags, we call these, and these are just other situations that we may have as far as health history that may say, hey, you better go get checked out and see if you have heart disease and see if you're at risk for heart disease. As you can see, there's many. I'm just going to shout out a few that are really relevant for women. One is chronic inflammation. Any inflammatory condition increases our risk about 20%, like an autoimmune chronic condition. Let me give you some ideas of what some of those are. Those are things like systemic vasculitis, psoriasis, inflammatory diseases, Crohn's disease cross the line, but majority of people who have systemic autoimmune illnesses have about a 20% increased risk of the development of heart disease later in their life. A rheumatoid arthritic individual is just as likely to die from a heart attack as a type 2 diabetic. Systemic lupus, if someone has lupus, particularly a woman, she has a twofold increased risk of dying of a cardiovascular or suffering a cardiovascular event in her lifetime. Psoriasis is also a comorbidity for cardiovascular disease. We often think it as a skin condition, but really it's a systemic inflammatory condition. Severe psoriasis is associated with a 50% increased risk of death, as many as 5 years lost life explained by either heart disease, infections, or cancers. Younger patients with severe psoriasis have a 2.5-fold higher risk of dying of cardiovascular events compared with their non-psoriatic counterparts. How about some other red flags for women? Do you know that women who deal with migraine headaches have a 90% increased risk of having a late life stroke? Do you know that polycystic ovarian syndrome is associated with the development of early plaque development? Matter of fact, 3 times increased likely to develop heart disease in their lifetime if they deal with the condition, metabolic condition of polycystic ovarian syndrome. The study suggests that women in their 20s with what's called PCOS are at an increased risk for the development of subclinical cardiovascular disease, so they need to be assessed early. Women who have preeclampsia during pregnancy, that's associated with high blood pressure during pregnancy, swollen ankles during pregnancy, spilling of protein in the urine via pregnancy. Well, when that woman is through with her pregnancy, the child is now 10 years old, she is at an increased risk for venous thromboembolism, and she's at a significant, I'm sorry, let me rephrase that. When the child is about 10 years old, she's at a twofold increased risk of heart disease or stroke events. And when the child is just entering kindergarten, she's at a twofold increased risk of having a venous thrombus or a blood clot in the venous system. Preeclamptic women need to get a full cardiovascular risk assessment 3 to 6 months after delivery, and it's rarely done. Gestational diabetes is linked with a 66% increased risk of future cardiovascular disease over a 12-year time frame. These women need more aggressive screening post-pregnancy for diabetes, cholesterol, and blood pressure. I often say, in all honesty, that if someone has gestational diabetes, it's not a question of if they're going to become a type 2 diabetic, it's a question of when. If you have none of those situations, consider the fact that women are at higher risk for heart disease events post-divorce than even their male counterparts. Surprise, surprise. 15,000 ever married patients followed for about 20 years. Divorced women had a higher heart attack risk regardless of post-divorce relationships. Let me share the data with you. Compared to non-divorced women, women who had been divorced once have a 24% increased lifetime risk of a heart attack. If they've been divorced 2 or more times, have a 77% increased risk. If they get remarried, even happily, they still stay at about a 35% increased risk. Here's the rub on this. Compared to non-divorced men, men only had significant heart attack risk if they were divorced at least twice. And it didn't matter if they were remarried. So men, they need to be divorced twice to show any risk or more. You know, now with the devices that everyone has, the Fitbits and so forth, that you know your resting pulse, I want you to check it, because it is true that if your resting pulse is above 76 beats per minute versus less than 62, you have about a 26% increased risk of a heart attack, which is important. It was stronger for younger women, ages 50 to 64. It was predictive against all ethnic groups, and it was independent of physical activity. So it doesn't mean, please understand, that if your resting heart rate is above 76, you're going to have a heart attack. It means find out why you have a higher resting pulse. It may be telling us something. Usually it's telling us something like prediabetes, actually. Spouses who care for their partners with cancer have a higher cardiovascular risk. They evaluated caregivers' risk of heart attack and stroke, and here's what I want to show you. When they looked at the women who were the caregivers, when they looked at those women who were caring for their loved one between 1 and 4 years, they had a 17%, that was the highest risk of heart attack. For stroke, when the women were caring for a loved one over 5 years, they showed the highest risk of all, which was 36% increased stroke risk. And I point that out only because that's when the community tends to stop coming over, stop asking if you need help. Women tend to not go to their appointments on time to care for their own health. They're not in the dentist regularly, all kinds of reasons for this. But please, if you have a neighbor, a friend, a family member, anybody that's caring for a loved one and has been doing so for over 5 years, show them a little love and take care of them for a while and give them some respite care that they might need. So what are those are what I call red flags, meaning if you've got these, you should be checked out. But root causes are situations that you need to be checked for these. So if you've had a heart attack, if you've had a stroke, if you have plaque, these items under this tree cause vascular inflammation, and if we fix them, the inflammation goes down. And that's the difference between a cause and an associated risk. If you have obstructive sleep apnea, you are at increased risk of dying of a heart attack by about 2-fold, but if you treat it, that risk goes away. If you have genetically inherited lipids, you need to find out. Low vitamin D, high blood pressure, high cholesterol, periodontal disease, genetics, insulin resistance or prediabetes, dysfunctional HDL, endodontic disease, inflammatory diseases, infectious diseases, and even psychosocial issues. Myeloperoxidase, which damages the artery wall, and any nicotine exposure whatsoever, secondhand patches, gums, vapors, cigarettes, cigars, I don't care what it is, all damage our arteries. So if you've had a heart attack or stroke, and if all you're getting is treatment for your cholesterol and your blood pressure and haven't been assessed for all of these things, you are at risk for another one and need to get appropriate care. So what can we do now? I mean, right now, to reduce our risks of a heart attack or stroke? So let's look at the top 10 list. So, number 1, be educated. Be educated. No one can make you feel inferior without your consent. So listen to your body, trust your body. You are the expert in your skin. No one else can dream to be. So if you don't feel right, go tell somebody about it and find out. If you have a family history and have genetic predisposition, then get checked out for sure. Read our book that spins stories of real patients just like you and me who have suffered heart attacks and strokes, and through their generous sharing of their own stories, we're able to weave in the science so that it really hits close to home and it's a really readable story. Understand that there's a different way than relying on the standard of care to know if you're okay or not. This platform of just looking at your cholesterol, your blood pressure, your age, your gender, your smoking status is sketchy. You may be picked up, but you may not. And this platform that we're on are allowing those terrible statistics I went over. Stand strong on the fact that you need to find out if you have disease. You need to know if you have inflammation. You need to know what caused that, and you need proper treatment. So the first question I ask you on education is, do you know if you have plaque hiding in the wall of your artery? You would have had to have some type of scan. A carotid duplex scan is not one of them. A carotid IMT scan, where you actually look at the artery wall. A carotid duplex looks here. So have you had that? Have you had a coronary scan? Find out if you have disease. Find out if you have inflammation. There's testing that can be done to find that out. Find out if you have any of these root causes, and if you do, you deserve treatment. So number 2 that I want to share is simply move more. It does not mean that we all need to start running marathons. It means we need to stand up during the commercials. We need to move our feet. We need to wiggle our ankles. We need to do toe lifts. We need to start moving. This survey troubles me greatly. It was done in 2011, and there's not a newer one that I can give you, but they surveyed over 450,000 people, and they asked, do you exercise? Do you get aerobic exercise? Do you get muscle strengthening exercises at least 2 days a week? Only 20% of adults were meeting the combined guidelines of aerobic and strength training activity. That is really a problem. Remember that physical activity reduces arterial inflammation. We have been ingrained since we were young, unfortunately, that the scale somehow is our mechanism to tell us if our exercise is paying off or not. And I don't like that either. Remember that exercise reduces inflammation of the arteries. The scale cannot tell us that. So there are a lot of very unhealthy skinny people out there, and there are a lot of very healthy people that carry a little bit extra weight, and that might be okay for them. But remember, it's the inflammation that we need to deal with. So every time you walk around the block, I want you to mentally think, okay, the inflammation in my arteries is coming down, and that's a great thing. How much do you need? Not a lot. You need about 22 minutes a day of cardiovascular exercise. That means moving your body enough where you're breathing hard. For some people, that's walking. For some people, that's just marching in place. For some people, that's sprinting. For some people, it's running. It doesn't matter what it is, but I want you to move your body 22 minutes every day. And just food for thought, for some people that cannot physically go 22 minutes a day, they also broke this up into 2 11-minute segments, and they had value as well. So if you get more than that, that's great. But do not put your head on the pillow at night without giving your body the gift of 22 minutes. We all have that much time. A patient once told me, sorry to digress, but it is important. A patient once told me who at the time was 81 years old, he's now 85, and he did not start exercising until he was 47. Oops, I lost connection. I think I'm okay. He did not start exercising until he was 47 years old, and he did that because his dad died at 48. And he asked himself, I need to exercise, and he kept telling himself, oh, I don't have time, I don't have time. And then he said, this little voice in his head said, if you don't have time now, how much time will you have? And I thought that was a brilliant quote. Do you know that just burning an extra 500 calories a week can reduce the risk of developing type 2 diabetes by 6%? That's huge. Do you also know that our children listen to us and we live by example? A question done at the University of Michigan, it said, it asked the students there who were exercisers. They were not there on a sports scholarship. They weren't getting paid to exercise. But it said, why do you exercise? And it was an open-ended question. There weren't options for answers. And they said, why do you exercise? And the number one response was because my parents did. So I've always taken that to heart. I'm a regular exerciser. I actually really enjoy it, so that's fortunate. My husband is a great exerciser, and so are all 3 of our kids. But I also feel as a healthcare provider, if I'm asking my patients to do something, I better darn well be willing to do it myself. And so, you know, if your provider who's dealing with your heart health isn't willing to do it, then organize walk clubs together, but do something, but be an example for yourself, your children, grandchildren, etc. Because they do pay attention. Be an example. Start early and continue it throughout. Continue exercise together as a family, as a lifetime. Expose children to all types of exercise. Doesn't have to be running or skiing or anything like that. It could be yoga. It could be anything, but expose children to all kinds of exercise types. We are active. We are healthy. I am active, I am healthy. So anything, I also feel that life is unfortunately short for many people. Even if we live to 100 years, sometimes it feels short. So I don't want people wasting their time with things they don't enjoy. So if you enjoy water aerobics, then do water aerobics. If you enjoy a peaceful walk in the park, then that's what you should do. You should find things you enjoy and just grab hold and do it. Okay, number 3, lifestyle matters. I want to share with you something that's happening in our country. This is what the United States map looked like in 1991. The states in dark blue, the Great Lakes states and the Southern Belt here, those are states that greater than 15% of the population carried an extra 30 pounds on board. I'm going to pull it forward just 8 years, and I want to show you how dark blue the map got just in a 7-year time period. So you can see in just 7 years, now pretty much the whole United States, and now they've even changed the key. So the stats now show how much of the population, is carrying an extra 30 pounds, and it's well over about 25%. And so 1 out of 4 people in every single state, which is really a sad situation. So we're growing both in size and numbers, which creates a dramatic health crisis. This was just published, and it's as late as 2010 data, and I just wanted to share with you the amount of individuals that are struggling with being overweight seems to be pretty stagnant. But what I'm really concerned about is that the more severe obese and extremely obese situation is getting worse, and it tends to be on a linear trend upward. The definitions are here. I don't want you to get too fixated on those, but body mass index is just taking your height and weight, and it's a calculation that anyone can do. You can do it online. And I just threw out there a 5'5" female is considered overweight if she weighs 150 pounds or more. An obese female at 5'5" is considered obese if she weighs over 185 pounds. And an extremely obese female at 5'5" would be considered in that criteria if she weighed over 245 pounds. So that's just something to appreciate, not to scare, not to make anybody feel bad, but to realize if we jump even into the overweight situation, we are taking on health risks that include not just heart disease and stroke, but also cancer, because obesity creates inflammation. So don't be afraid of the scale. So many of us are afraid of the scale, and we don't want to get on it, and it seems problematic. And I wanted to share with you that it's actually a tape measure that's more valuable. So if I had to pick whether you own a scale or a tape measure in your house, quite honestly, I'd say own a tape measure. And for us as women, we want our waistline less than 35 inches. If it starts to creep over 35, realize that we're carrying weight in a very dangerous part of our body. And this, my friends, is genetics. So if you start to carry weight in the middle, you're recognizing what your ancestors have dealt with as well. And you need to own it, and you need to say, I'm not going to let that happen. And realize that if you lose 1 inch off your waist, you've dropped about 10 pounds of fat cells. So congratulations on that. I really am a fan of measuring waist. We do it on every patient every time they're here because it gives us a very appropriate look at their cardiovascular risk, even more so than weight. So in addition to eating a healthy diet packed full of fruits and vegetables, what else can we do today? Here's a fun one, practicing mindfulness. Mindfulness is simply being in the moment and thinking positively. Well, this was a really well done, thought out study, and they taught these individuals how to practice mindfulness. They did it 15 minutes per day, and they monitored 5 different things. They measured their chest pain, they measured their sleep quality and efficacy, they measured their anxiety and depression, they measured their blood sugar and their blood pressure. And do you know that mindfulness reduced all 5 of those statistically so in these individuals, which is wonderful. Mindfulness for some people is defined as prayer. For some people it's defined as deep breathing. For some people it's listening to nice music. Whatever it is for you, you need to start doing this tomorrow because it'll make you healthier for sure. Music is a wonderful tool to decrease arterial inflammation. They've shown actually some studies that show enjoyable music increased blood flow by 26%, which dilated arteries as much as statins and aerobic exercise. So I think the key word there is enjoyable. So if you find it enjoyable, someone else may not. So what my kids listen to may not lower my heart attack risk, but it might lower theirs, which if I'm driving my own car, I'm in charge of the radio. I'll just say that. Diet soda, just don't drink it. Promise me. Do not drink any more diet soda. Get rid of it. It's overrated and it'll kill you. Diet soda, taking one a day, increases vascular events by 50%. That's really not good. And they've really done sophisticated studies through MRI studies of the brain to hormone studies to gut microbiome studies. And the ingredients in a diet soda really change our bodies in such a way that we have a systemic inflammatory state that's not healthy whatsoever. They've shown it, of course, with sugar-sweetened beverages as well. So, you know, each additional serving per day of a sugar-sweetened beverage was associated with a 19% increased risk of heart disease. So we need to be really diligent with that. And I always tell people, don't drink your calories unless it's a packed full vegetable with real fruit blended drink with no sugar, no juices. Then don't drink your calories. Just don't do it. Number 4, stop any exposure to nicotine. Nicotine exposure accelerates a woman's risk of having a heart attack by at least 10 years. So they're 10 years earlier to the emergency room with a heart attack than their non-nicotine exposed counterparts. Secondhand smoke matters. They've even measured the arterial wall of infants, of mothers who are exposed to secondhand smoke through even the father that's smoking or the mother, and they've shown that after these children are born, their arteries are inflamed, which is a really powerful statement for a lot of women to understand that fact. Number 5, what about blood pressure? I would say know your numbers. You know, carrying a blood pressure of 115/75 is optimal, but by the time it gets up to 135/85, you have a 2-fold increased risk of dying of a heart attack. So don't let anyone tell you that 135/85 is normal. This study was recently published about a week ago, and it looked at over 8 million people. They were over 25 years old from 154 countries. They showed something problematic, and that is in the last 25 years, the rate of systolic blood pressure, which is the top number, of 110 increased from 73% to 81% per 100,000 people. Why does that matter? Because heart disease and stroke accounted for the majority of disease burden related to systolic blood pressures over 110. Nearly 30% of this burden occurred in individuals with a systolic blood pressure between 115 and 140, which sadly is not paid attention to in a lot of medical situations. Chronic kidney disease contributed to the burden almost as much as cardiovascular disease. Whether someone's on dialysis, whether they're having heart attacks, the arteries do not like high blood pressure. A systolic blood pressure of 110 remains one of the largest risks for decreased human health, greater than tobacco, and a high body mass index. Prevention and control of blood pressure greater than 110 through a combination of behavioral, lifestyle, and drug treatment could mitigate this growing burden in healthcare. So it's really important to appreciate. This was the SPRINT trial, and it was published at the end of 2015, and they looked at lowering people from a systolic blood pressure of 140 to less than 120. And when doing that over a 4.5-year time period, they showed a 33% reduction in primary heart attack and stroke outcomes, meaning 33% less risk of having a heart attack or stroke, and a 25% reduction in all-cause death. That means cancers, heart attacks, strokes, hit by a bus, a tree falling on you. So keep your blood pressure in good control. Okay, the next I'm going to talk about is cholesterol, but I'm only going to mention one element of cholesterol, and it has to do with women, us in particular. As we age and we go, our bodies go through hormone changes and we lose our own production of estrogen. What also happens is our good cholesterol starts to fall. Our good cholesterol is called HDL. Think H high or happy. You want that as high as can be. So as we get older and we lose our estrogen, that good cholesterol slowly starts to fall. So the question is, does it matter? Yes, it matters. HDL, or the good cholesterol, we call food for the brain. The brain loves HDL. So we really do need cholesterol. We just need more of the good. Each 1-point elevation of HDL reduces stroke risk by 1.9%. So if your HDL goes from 50 to 60, you've ultimately dropped your stroke risk by about 20%, which is fantastic. What about memory loss? All of us are concerned about losing our memory. That claims our independence more so than probably anything else. And if our HDL, our good cholesterol, is less than 40 versus keeping it above 60, there's a 27% increased risk of memory loss by the age of 55 and a 53% risk by the age of 61 of having memory loss. So we've got to keep our good cholesterol as high as we can get it. Number 7 is a big one, prediabetes and diabetes. Prediabetes is called insulin resistance. And 7 out of 10 people who have plaque in their arteries have insulin resistance. Do you know also that it takes about 20 years of being insulin resistant before you're actually told you're diabetic? And the scary part is the arteries are being beaten up for about 20 years. It's associated with all kinds of problems like high blood pressure, low HDL, vascular inflammation. All that's going on before someone's told, wow, you have type 2 diabetes. This is something that we hear a lot. Because prediabetes damages the arteries, sometimes the first symptom of someone having diabetes is a heart attack. And we've heard patients say, oh, the weirdest thing happened. My sister caught diabetes, oh, that should be she, when she was in the hospital for her heart attack. So the problem there is when people go in for their heart attack, sometimes it's discovered at that moment that they have diabetes. Well, remember, insulin resistance had been going on for 20 years. So those arteries were so damaged, that's what triggered the heart attack. When someone's insulin resistant, they have all of this stuff going on. And if you think about an iceberg, you have to appreciate the things above the surface are what we see, we can feel, we can touch, we can treat. Things like high triglyceride, low HDL, high blood pressure, sleep disorders, central weight gain, gout, fasting blood sugars that are creeping up. All of this goes on, and sadly in Western medicine we treat each of them as if they're independent, and we don't even realize the fact that all of this stuff is going on underneath the surface, causing arterial wall damage. And if we find out if we're pre-diabetic, it's a treatable condition. So amazingly, we treat all of this plus the diabetes risk, which is really important. So what about stroke risk and insulin resistance? That's an important one as well. Insulin resistance increases the risk of having a stroke by about 3-fold. So that's important. So wouldn't you want to know if you have prediabetes? By the time someone has become diabetic, they're actually more likely to have a stroke than a non-diabetic who's just had a heart attack. So it's a really concerning population. So I would say, if you have a family history of heart disease, if you have a family history of stroke, you don't have to have a history of diabetes, because a lot of people in generations past had died before they ever got diagnosed with diabetes. So I would say any cardiovascular history, or diabetes, of course, get checked. Get a glucose tolerance test. Know your risk. Do not wait for diabetes to find out that you are insulin resistant. And in our book, we talk about what tests are specific for that. Number 8, see your dentist and hygienist regularly. Do you know that gum disease is associated with heart disease, which is important? And not only is it associated, but we have proven, based on this study we published about 2 months ago, that the pathogens or bacteria that live in our gum line cause a change in the arterial wall health. Those bacteria that cause gum disease increase the quantity of cholesterol floating around in our bloodstream. They also cause a vulnerability of that artery wall. And lastly, they cause those cholesterol molecules to be trapped in here and start to form plaque. So if you have gum disease, realize it's not just in your mouth. It actually affects what we call the atherogenic triad. So realize that if you have periodontal disease, you're at about a 4-fold increased risk of having a heart attack and a 2-fold increased risk of having a stroke. Ask your dentist and hygienist to test you for these pathogens. It's a saliva test, and know if you have any of these pathogens that can affect the arterial wall health, because again, they're treatable, but you don't feel them and you don't know you have them unless you test for them. Number 9, sleep is critical. We in this country do not get enough sleep. And I'm not just talking about sleep apnea, I'm talking about sleep in general. Less than 6 hours of sleep triples our risk for diabetes and obesity. 70% of people in America have some sort of sleep problem, whether it be restless leg, sleep apnea, interrupted sleep, whatever it is. And out of that 70%, 60% are identified with a chronic problem. It's no longer cool to cheat your sleep. So if you are finding yourself falling asleep during the day and not being able to fall asleep at night for whatever reason, please go find out. And the worst thing you could do for yourself is not go get a sleep study if you feel you might have any risk for apnea, because apnea is one of the most troublesome conditions. It makes it very hard to lose weight. It makes it very hard to control blood pressure. It makes it very hard to control cholesterol. It makes it extremely hard to control vascular inflammation. And yet, if you identify it and treat it, all of those things are not a problem. So really, I do want you to appreciate the fact of sleep, restless leg syndrome, interrupted sleep, it all matters. Number 10, realize that you matter. I want you to tell any bit of this information to a friend. I want you to teach a friend something you learned today, and by doing so, I know that you will save a life. Remember, unless we do something different, the stats are going to continue, and I'm very optimistic that they don't have to, but I feel very strong that we need to be our best advocates. No one can make you feel inferior without your consent. I've said this one before and I want to say it again. Listen to your body and tell a friend what you've learned. Live strong, live educated, and please live well. The American Heart Association has wonderful information on their Go Red campaign. We have information in a whole chapter dedicated to women's heart health in our book, Beat the Heart Attack Gene, which is available on Amazon.com. Please educate yourself and those you care about for sure. Find out if you have vascular disease. How awful it would be if the first time you know you have disease is because you've had a heart attack, like 64% of women. The first time they find out they've had have plaque is because they have a heart attack. That doesn't need to happen. So as Maya Angelou said, do the best you can until you know better. Then when you know better, simply do better. So thank you for allowing me to share this information with you today, and I want to just leave with a statement to say, be strong, ladies, and smile. Each day matters, and each day is a gift for sure. So I do have a few minutes. If anyone would like to ask a question, I don't know if it's possible because there's a lot of people on the line, but Patrick, if you're still on, perhaps you could field a few questions. And if not, that's okay too. Okay, I don't think Patrick is on, and I don't have the control panel to tell if anyone's asking a question. So I think for that, I'll go ahead and end. Thank you so much. Everyone have a wonderful evening.